a measles maelstrom, a double-digit surge in cases sweeping the U.S. The United States is grappling with a severe measles outbreak, with case numbers exceeding all of 2024's totals by more than double. Texas, the epicenter of this alarming surge, reported yet another significant jump in cases and hospitalizations on Friday, painting a grim picture of a rapidly spreading, highly contagious disease. This multi-state outbreak confirms the worst fears of health experts, that measles, a preventable illness once eradicated from the U.S., is finding fertile ground in communities with lagging vaccination rates. The implications are far-reaching, with the potential for this outbreak to persist for an entire year. The sheer scale of the crisis is staggering. While precise figures for 2024 are still being finalized, the current count dwarfs the total number of cases reported for the entire previous year. This dramatic escalation highlights a critical lapse in public health infrastructure and underscores the urgency of addressing vaccine hesitancy. The situation has spiraled to a point where the number of infections this year already surpasses the cumulative total from the entirety of 2024, showcasing a concerning acceleration in the spread. Adding another layer of complexity to this health emergency, the World Health Organization, WHO, recently confirmed a link between the Texas outbreak and a surge in measles cases in Mexico. This international connection underscores the trans-border nature of infectious diseases and highlights the necessity for coordinated global responses to prevent further spread. The interconnectedness of our world is brutally evident in this alarming situation, demanding collaborative efforts between nations to curb the further escalation of this highly contagious virus. Measles, caused by a highly contagious airborne virus, spreads with alarming ease through respiratory droplets released when an infected individual breathes, coughs, or sneezes. The virus's insidious nature makes it particularly dangerous in densely populated areas and communities where vaccination rates are low. Children, especially those too young to be vaccinated, are particularly vulnerable, facing severe complications such as pneumonia and encephalitis. However, this disease is not confined to children. Adults can also contract the illness, often with more severe consequences. The good news is that measles is entirely preventable. The highly effective measles, mumps, and rubella (MMR) vaccine offers robust protection, effectively eliminating the risk of infection for the vast majority of individuals. However, vaccine hesitancy and misinformation have fueled a resurgence of this once-controlled disease, jeopardizing public health and placing vulnerable individuals at grave risk. Increased vaccination efforts are crucial, not only to control the current outbreak, but also to prevent future surges. This requires a multi-pronged approach including improved public health messaging, addressing vaccine misinformation, and improving access to vaccination for underserved communities. The current situation is a stark reminder of the importance of vaccination in protecting public health. Measles, once eliminated from the U.S., is now staging a devastating comeback. The drastic rise in cases is a wake-up call, demanding immediate and concerted action to halt the spread and prevent long-term consequences. This includes increasing vaccination rates, combating misinformation, and strengthening public health infrastructure to effectively address and prevent future outbreaks. The fight against measles is far from over, and the collaboration of healthcare professionals, public health officials, and communities is crucial in achieving victory over this preventable disease.